Hey everybody, Joel Johnson here, Director of Alumni Relations here at Southeastern. Tuesday tour time, and obviously we're doing things a little different. We are going into the nursing simulation lab, and I am all ready to go. I'm playing a doctor on TV today. So come on in, and let's check this amazing place out. See if we can find somebody to hang out with us today. We do have somebody. So if you could please introduce yourself.
Hello, Joel. How are you? Nice to meet you.
See
Hello, fellow alumni. Gina Kirchner here, and I am the manager of the Simulation and Nursing Labs.
This place is amazing. We were walking around a little bit, and I just had to get into the moment. So I feel like a little kid who used to dress up like Superman all the time. I did that.
Tilly has to clean up a code brown, but that's okay.
Yeah, I don't even want to know what that is. So a little bit before we get started.
Yes.
How long have we had this program here at Southeastern?
Well, we're still fairly new. Southeastern's nursing program has been here going on about 5 years now. We'll be graduating our third senior class this Friday at commencement. We would like to brag, though, that our pass rate for the state NCLEX is about 92%. So that's
like
good.
Way better than everybody else,
Absolutely.
right? Because this is Southeastern.
Absolutely.
And we just do it better. How many students do we have in the program?
We currently have about 74 students in the program, which is really good because our
patients.
We have somebody in labor right now. Sorry about that.
Going in.
Which is really good because what's nice about Southeastern is that we do have a low student to, I'm trying not to say patient to nurse ratio, student to professor ratio. So our class sizes are about 30 students per class.
Now, something awesome that's happened is the program grew really fast.
Yes.
And a lot. And we've had to expand, right?
Absolutely.
To another facility.
Absolutely. Only being 5 years old, this used to be the lab for both simulation and our students learning their skills and assessment skills, but we have outgrown this. Word has gotten out of how amazing Southeastern is, so now we only do simulations in here, and we've been blessed with 2 modular buildings outside of here that we call the nursing teaching labs. And so our first semester juniors that come in, that's where they start, and they go there and they learn how to assess patients, how to listen to lungs, listen to heart sounds, how to do particular skills if they need to start a urinary Foley or a gastric tube. They go over there and they practice and learn that all over here, and then when they're done, the next semesters, they start coming in here and taking care of patient scenarios that are hospital scenarios.
About to go through and check out these simulation patients. There's a fancy name, and I don't remember it. A great thing about this program is students can come here and never have to transfer. They never have to go anywhere else. They can do everything they need right here, which is rare amongst Christian colleges. So this is a great thing that we've got.
Yes.
So if you could please take us through now
Come on,
and
right
show
this
us
way.
this awesome
SCU
stuff.
Hospital right here. Caitlin, you can make the simulator say something if you want. Come on in. We are so blessed here at Southeastern University, and our nursing students get to come in and practice with some of the best equipment that's out there. These are CAE human patient simulators, and they act just like the human body. Their pupils constrict, eyes blink, heart sounds, lung sounds, pulses everywhere. They do talk and communicate with you as well. I am so sorry, Mr. Smith. I'll be more careful with that. Also, the software that we use in the control room that I'll show you over here, right this way.
So how many students would be working in here at a time?
Well, again, because of growth, we used to only have about 12 at a time. We have just implemented this semester to where we're running 2 simulations at the same time. So what happens is we can have up to 20 students. We can have 5 running a scenario at bed 1, while the other 5 are in this conference room that's in the process of being constructed. We'll be viewing, while another group of 5 will be caring for a patient here, and then the other 5 will be in this conference room here. And let me show you what this looks like. The other 5 students will be in here watching the other 5 take care of the patient. And then in the middle of the time, we will stop and we'll do change of shift. And so then the students will come out here to the other group, and they will take what we call report on how the students are doing. We'll have approximately about 5 students that will have different roles. We'll have a charge nurse, registered nurse, a CNA. My goodness, let's see what's going on in here.
I think someone's in labor.
Yeah, everybody loves this room. This is our mother-baby room. And right now, Lucina she's already had one baby, and now she's back to have another baby. Don't ask any questions, please. But she's in labor, and what's lovely about her is she will actually birth this baby naturally. So the students will be able to have the real-life experience of doing that. Now, she does have military speakers, as you've heard. So when people are walking down the sidewalk, a lot of times they know what's going on in here. Now, mom can have regular, healthy births, or problems can happen, and then the nursing students just know how to save mom and save baby.
So you guys in the control room, which
Yes,
you
sir.
mentioned before, which we'll check out, you can create the scenarios ahead of time. Can you adjust on the fly
Oh,
to make
absolutely.
them react to
Absolutely.
new stresses?
Let's
and
go
everything?
take a look at the control room if you like.
So
Oh, go ahead.
the baby's turning blue, which is not good.
Correct.
So what would be causing that?
Well, we call this cyanosis. And what that means is that baby does not have enough oxygen getting into the blood on the cells and distributing it through where there's oxygen needed. So typically what we have to do is suction baby, make sure he's getting good airway exchange, and start working down the list that way until we can fix it.
So when a student, the students are in here working together and somebody's observing, does the baby automatically respond to what they're doing, or do you guys impact that from the control room?
A lot of times we impact that from the control room
Okay.
because it's based on what does the student do.
Right, okay.
The student's actions will dictate what happens next.
Okay,
And
so if they
then-
do the right thing, you guys control the symptoms.
Absolutely.
And that's incredible.
Yep, absolutely. Now our adult simulators, they can run a little bit differently.
Okay,
We'll come in here. This is our control room.
okay.
And this is where all the action happens. We typically have 3 or 4 computers here, 3 or 4 computers here. This is the software to the simulators. And this is set up based on human pathophysiology.
Okay.
And what that means is, if we go to the hospital, somebody gives us a beta blocker, which lowers heart rate and blood pressure. The system knows that, and so if a student gives a beta blocker to the simulator, we don't have to manipulate and change
It
the
does it
heart rate.
automatically.
Right, it's
Wow.
documented, that's what they gave, and it does it automatically. Now, this is built into if the students do what they're supposed to do, we can go up here and change to the next, what we call state. And then when we do that, this software automatically positions the patient to their current status based
Okay.
on what the student. So we don't have to make any real changes.
Now, we talked earlier about a situation with the, what's her name again?
Lucina.
Lucina.
Yes.
Where there's a bad situation.
Yes.
And the students got very emotionally
Yes.
invested in it.
Absolutely.
And I would think that's a great thing, having to
Right.
deal with a situation that goes bad, because they're going to face that.
Absolutely.
So,
And that's what we tell the students when they start here.
Mhm.
You know, we want you to be very transparent.
Right.
We want this to be safe learning. You know, go ahead and throw it out there. What do you think you're supposed to do? What should you do? And if it fails or you make a mistake, that's okay. Make the mistake here.
Right.
Let's make that correction, and then you can safely take care of the community in the hospitals.
and you told me about something else that's very real. You said one of the male students went to Lucina, that's her name?
Yes.
And patted her on the
Try to
shoulder.
console her.
And she was like, "Don't touch me!"
Right.
And I've been there. That's real. So, anything else you can show us?
Oh, let's see here. Let's come over this way. Yes, I'd like to show you this.
Okay.
Okay. So when the students are in their first semester as seniors, okay, they can start doing a little bit more invasive skills. So this is our IV simulation area. So the students will log on here and have an assignment to get through a certain level. So what this is it will give them a hospital scenario of a patient coming in, and they're reading the scenario. They have to decide what's going on with this patient, what kind of meds are they going to need, what size needle do I need, and where do I need to put that IV.
Wow.
So they have to go through all that, do it successfully. This acts as a patient arm, This is the needle. They learn how to put it in and thread it, and do everything that they're supposed to do and pass, and they have to pass an exam.
This is much better than practicing on their classmates.
Yes,
Yeah.
we've come a long way, right? So after they get past that, then they move on to the arms, and these have veins in them, and they can actually start an IV in here. They'll get blood that flashes back, and then once they get checked off, just like an exam, that we think they're safe and competent, then we sign them off to go do it in the hospitals with the patients.
So how many times can something like this be used? Like, does it have to get a new sleeve put on
we
it?
did
or?
put new skins
Okay.
on them not
Okay.
too long ago.
All right.
So after a while, because they practice on them in the labs,
Yeah,
and after
yeah,
a few
yeah.
semesters, then we'll change them out. Yeah.
Well, this is amazing.
Oh, I'm excited.
And, I knew that we had this awesome program, and I'd heard about it. And we had talked when we were out in Houston at the Fine Arts Festival,
Yes.
and you guys told me all about this. But I'm blown away by what I saw. And the fact I got to dress up for it is even
Yes,
cooler.
yes.
So thank you so much.
Oh, God bless.
And
Thank
this
you.
has been great. And alumni, if you know of people
Yes.
that are looking at this as a field, they need to come here and do this, because it is amazing. The students coming out of here are doing better on their tests than other schools in the state, like every other school in the state, even the big ones, which I won't name. But anyway, it's an amazing program. Send your friends, send your kids. Learn how to deliver a baby. So thanks, guys. We'll see you next time. Have
God
a great
bless.
day. Bye.
Thank you.